Welcome back to Base Sunday. Hepatitis B is the most common serious liver infection in the world. It is caused by the Hep B virus that attacks the liver cells and can lead to organ failure, cirrhosis, or even cancer. Hep B Free campaign is a project raising awareness about the virus, routine screenings and vaccinations. Well, they're a big help. And here to chat is Arcadi Kolchak, the campaign director of the Hep B Free Santa Clara County. How are you?
Doing great.
Great to have you.
Nice to meet you.
How big a problem is this right now?
Well, there are approximately 800,000 people each year around the globe that end up dying from hepatitis B and the complications that arise with liver cancer. Approximately 1 in 10 Asian and Pacific Islanders are chronically infected with it. 2 out of 3 don't know they have it, and 1 in 4 will likely develop liver cancer or liver disease, ultimately leading to death.
So a simple screening could
save a life. Definitely.
Absolutely. And you're putting together a campaign now to get people to come out and get screened.
Yes. Definitely.
What happens when you get screened?
So when you get screened, you get a small vial of blood drawn, and they process those results within 3 to 4 weeks, and you can find out whether or not you've been vaccinated for hepatitis B and whether or not you are a chronic carrier.
And we were talking off camera, but you may not even know. You could be a carrier and not know you have it, right?
So one of the big things with hepatitis B is that it's known as a silent killer. So you typically will not know whether or not you have it until it's too late. So that's why we encourage people to go out and get screened and find out what their status is. And
could you have it, the incubation period could be a matter of years?
Yes.
You may have contracted it 10 years ago and then it finally kicks in?
Yes. So the most common form of transmission is mother to child, perinatal. And when when a mother has hepatitis B and she passes on to their children, in other countries they don't typically screen for that. Over here that we do, fortunately. And if they're not screened for it, if they end up being a chronic carrier, then they can develop hepatitis B and chronic liver infection by their mid-20s, early 30s.
What are the symptoms?
So jaundice would be the first thing that you would notice. Other things that would happen would be doubling over in pain because your liver is filled with scar tissue and you need to be rushed to the hospital. And one of the stories that we tell is of Dr. Mark Lim, who actually just graduated from medical school and discovered that he had hepatitis B. And unfortunately, they told him that that's not something that he has to worry about. But if he wasn't of API descent, which he was, he wouldn't have had a problem. He was about 25, 26 years old, I believe, when he was out with his friends, doubled over in pain and had to be rushed to the hospital. And they discovered that he had late-stage liver cancer.
Oh, my gosh. How do you get it?
Mostly mother to child. It's also an STD. It can be transmitted through blood.
Yeah. Okay. And we mentioned if you do have it, you may not even know. Now, May 19th is National Viral Hep Testing Day, right? Tell us about that.
So there's a huge effort that's going on right now with San Francisco, LA, New York, Seattle, and Chicago, where we're putting together this giant effort for National Hepatitis Testing Day to try to get more people screened. San Francisco, for example, last year screened over 5,000 people for hepatitis B within the Asian Pacific Islander communities.
Why is that community so more susceptible to hepatitis?
That's a difficult question to answer. Let's see. So a lot of it would have to deal with the healthcare systems in the other countries. Yeah. And a lot of the patients that we end up treating over here that are identified to be chronic carriers of hepatitis B are actually foreign-born. So they're the more susceptible population.
And what you've got the Hep B Free in Santa Clara. The push is on for that.
Yes.
Right? Tell us about that campaign.
So Hep B Free Santa Clara County, I work with steering committee members from the Asian Week Foundation, the Asian Liver Center at Stanford University, Asian Americans for Community Involvement, and also the Department of Public Health. And we recently, last summer, created a position at the Department of Public Health through the support of various county supervisors, Supervisor Yeager in particular, for a hepatitis B prevention coordinator, and that individual had just been hired. So we're working collaboratively now to build more relationships within the community. I'm a campaign director because I feel like it's running a campaign, building more support with nonprofit organizations, other corporations, hospitals, and elected officials to champion this issue and raise awareness for the cause.
If we want to get screened, where do we go?
So you can go to Northeast Medical Services in San Jose or all throughout the Bay Area. They have about 10 facilities around here, and also El Camino Hospital's Chinese Health Initiative or Pacific Free Clinic at Stanford University.
All right, you know your stuff, Arcadi. Thanks so much for coming in. We appreciate it. If you'd like more information on how to help or to find out where you can get tested, log on to Hep B Free SCC.org. That's Hep B Free SCC.org. There we go. That's it for this week's edition of Base Sunday. We will be back next week. In the meantime, enjoy, everybody. Take care.